opportunity to gather here once more this morning to listen to our weekly talk. This week, we'll be focusing on health tips. And the focus of our presentation today will be optimizing health in Ramadan, managing common health concerns. We all know that the Ramadan is a few days from now, and we are all desirous to fast. However, some of us have one challenge on the other that might be a limiting factor to us fasting. Yes, in as much as Almighty Allah has commanded us that those of us that are sick should abstain from fasting, and you repay it back when you are well. But we know this also constitutes a major challenge to people. That enthusiasm to repay it back outside Ramadan is very difficult and challenging. So when we all fast together, it's very easy for us to accomplish this fasting. But however, we can take certain precautions even when we have health challenges. There are certain health challenges that will permit us to fast. But when we are not able to continue with the fast, we are also advised to break our fast in order not to compromise our health. So this morning we have put a team together that will be talking to us on how to manage our health in the month of Ramadan. So we have 3 of our doctors from the University of Port Harcourt Teaching Hospital that will be talking to us this morning. So we have Dr. Shafiat Teniola Salau, who will be leading the team, and I'll give her the privilege to introduce other doctors, other colleagues that will be discussing this issue, this topical issue with her this morning. So Dr. Shafiat, Bismillah.
Asalamu Alaikum Warahmatullahi Wabarakatuh. It's always an honor to be called to share knowledge. Alhamdulillah, another Ramadan is upon us in good health. Alhamdulillah that Allah has counted us amongst those who would witness another month of mercy, and to tap in all the rewards we can in this highly privileged month. Alhamdulillah Rabbil Alameen. We ask Allah to accept all our intentions and all our actions that are going to follow during Ramadan. Of course, we know that having good health is extremely important to be able to carry out all of the intentions, the plans we have during Ramadan. And so I find this topic extremely pertinent before we start Ramadan. We'll be speaking today on optimizing our health in Ramadan, where we'll be shining the torch on diabetes, hypertension, peptic ulcer disease, pregnancy and menstrual abnormalities, halitosis, which is also known as bad breath or mouth odor, and routine eye conditions, just to touch on some specific topics that are quite common in our environment. With me, Dr. Faith Walwe. Dr. Faith Walwe, who is a senior registrar in internal medicine at the University of Port Harcourt Teaching Hospital. She'll be doing justice when it comes to diabetes and peptic ulcer disease particularly, because these are two diseases that must be managed very carefully in Ramadan so that you don't tilt into, you don't tilt into a position where you're unable to fast. And so these are highly important topics. She'll be doing justice on those two topics. There's Dr. Azizat Broimo, who she said she's very close. She will be doing justice on pregnancy, menstrual abnormalities in general during fasting. We know that sometimes people have different thresholds when it comes to pregnancy, and so she'll be doing justice to that. And then I'll be talking about routine eye conditions, halitosis. In general, all three of us are medical doctors, so we will augment one another's presentation, but just so that we have specialists in each field, just to give us a more holistic experience. Please, I need the slides to be on, so that we can all see the presentation. I've just introduced you. Okay, so perfect. Please, next slide. So by way of introduction, I think everybody know me. My name is Dr. Shafiat Salau. I'm a senior registrar in the Department of Ophthalmology from the University of Port Harcourt Teaching Hospital. I'm just going to give a brief introduction. So I'm just going to be giving a brief introduction on Ramadan. As Muslims, we are all aware that Ramadan is a sacred journey where we fast, where we reflect, and where we practice self-restraint. Restraint from, sexual intercourse, restraint from talking bad, restraint from just all sorts of wrong deeds. It's not just about the fasting, it's about your intentions, your actions. And so that's what Ramadan is all about. However, because our body is going to be going through rigorous changes during this fasting period, there has to be a delicate balance between honoring our spiritual obligations and safeguarding our health. And so we have to be on top of our game in safeguarding our health while our body grows through these rigorous changes to practice fasting. And so to get the best out of Ramadan, there has to be an intersection between faith and health. And so we have to ensure that our health is of priority, our deeds are of priority, everything has to be of priority together. And that's when we can get the best outcome out of Ramadan. So now, shedding the light on illness and Ramadan, Allah has told us in Surah Al-Baqarah, verse 184 to 185, Allah says, observe fast for a fixed number of days. But if any of you is ill or on a journey, the same number should be made up from other days. And he mentioned some other things, and then he ended by saying, and that you fast is better for you if only you know. So taking this ayah, it means that whatever happens, the best thing Allah wants from us out of all options is that we fast. That you fast is better for you if only you know. And so our priority or our goal should be how to ensure that we fast. If there's something we can do to get better at our health, if there's anything we can do that we can change, we have to try to do that so that we can get the best outcome, which is to fast. Allah also mentioned in the next ayah, whoever of you sights the crescent, he must observe Saum, which is fasting. And whoever is ill or on a journey, the same number of days must be made up. This is again just reinforcing the previous surah. And then Allah ends with this very important statement, which I'm going to make, and which is going to set the tone for the rest of what we're going to be talking about today. Allah intends for you ease, and He does not want for you difficulty. That is a very important point that we have to bring out, and we have to remember at the back of our mind, for as in during this entire lecture. Allah intends for you ease, and He does not want for you difficulty. And so Muslims, we have to take the fact that Allah says fasting is better for you if you know, and Allah does not want for you difficulty. We have to put those things on a scale and balance it in relation to whatever complications or whatever issues we are dealing with in terms of our health. And so I'll be starting with some general well-being tips. First of all, just to general talks. When it comes to fasting, we have to work on our nutrition and hydration. Of course, we know that fasting is when we stay away from water, we stay away from all sorts of things. And so we have to be able to compensate with our nutrition and our hydration when we are allowed to eat. And so we advise eating slow digesting foods during sahur. Slow digesting foods such as oatmeal, such as eggs, wheat, whole grains. These are foods that slowly digest over time and are the best meals to be eating during sahur. If you take things like rice, white bread, these things spike very fast and then they just deteriorate very fast as well, and so they don't sustain you over a period of time. And so eating slow digesting food is advised during sahur. Eating hydrating fruits during iftar as well also helps to boost your hydration. Fruits like cucumber, watermelon, and then drinking water during iftar and suhoor as much as you can. This helps to compensate, for that period of time when you are allowed to eat. Also, because you are fasting doesn't mean you should completely do away with physical activity. We should try as much as possible to practice light physical activity during Ramadan, such as walking, stretching. For women, you can stay on your bed, just stretch. Stretch your body, do what you need to do, move your arms. We all know that as women get older, you begin to have a lot of joint problems, from osteoporosis, osteoarthritis, whatever. And so we have to practice more physical activity during Ramadan because our bodies are already going through it. And so exercise would really help boost your overall well-being. Then infections. We know that here in Nigeria we have a culture of taking anti-malaria before the malaria even starts. I don't know where we got that culture from. You'll be using anti-malaria tablets before there is an actual malaria is wrong, because it's not going to stop malaria from coming. Using anti-malaria before there is a diagnosed malaria does not stop you from having malaria when malaria finally comes. And so I think the smarter thing to do is to use your insecticide treated nets, keep your environment clean, whatever it is that is going to protect you from the insects that would cause malaria. That's a smarter thing to do. And when you finally do have malaria, because it's endemic in our region, then you treat when you have malaria, not treating before malaria and saying, Ramadan simple, come anti-malaria, come one medicine, I mean, it's really not the right way to go, okay? And so stress reduction generally during Ramadan, like I mentioned earlier, our body is going through stress. And so whatever we need to do to reduce stress, we have to start practicing that before Ramadan and during Ramadan. Apart from whatever issues we're going to, let's wrap it up, put it in the hands of Allah, dhikr, prayer, and sleep, good quality sleep. We know that Ramadan is a period of intense prayers and everything. You wake up for tahajjud, you do your tarawih, everything. But factor in good quality sleep amidst all that, so that at the end of the day, your body is not shutting down, especially when you need to be, really awake. For example, some people will start, Ramadan ti bẹ̀rẹ̀ fast tahajjud from 2 o'clock to 6 o'clock. One lobishe, one day. When it's now last 10 days of Ramadan, they will now break down. That is not a very smart way to do things. It's all about balance. It's all about portion. Portion your time, portion your sleep, portion everything so that you can go through the entire fasting exercise without breaking down in between. And then if you do have any ongoing health challenges, please visit the hospital before Ramadan starts. Schedule an appointment with your managing physician. If it's hypertension, if it's diabetes, let them give you your medications, and you stay on the medications throughout while you're fasting and even beyond fasting. Okay, so I'm going to quickly touch on my own part of the discussion, which is managing routine conditions. Now, we have a lot of elder or people above 35 in this gathering. And once you are above 35, there's something called presbyopia that a lot of us are dealing with. It means that we are unable to see tiny prints as well as we used to see it. We won't be able to see it as well as we used to see it back in the days. And this can expose us to things like eye strain, like headaches, like tearing, especially when you are reading your Quran, because now you are forced, you want to read the Quran, you want to finish the Quran, and a lot of this Quran are in tiny text. And so some people already have their glasses, which is really good. Some people know that they have that problem, but they are not wearing glasses. It's not I don't know why you should put yourself through that strain. If you are not seeing well as a result of age, please get glasses that can aid you to see well when you need to see. Okay, so let's go look at our eyes. If we have problems with our vision, let's go get it checked. If it's glasses we require, let's get the glasses so that we can reduce what we call asthenopic symptoms, which are the eye strain, tearing, headaches, etc., that can impede you from reading your Quran, as much as you want to. Secondly, for those who use screen, we use computer screen a lot of times. There's something called the 2020 rule, which enables us to, tolerate the computer screen more. And this 2020 rule means that every 20 minutes on the screen, whether it's your phone or the computer or whatever it is, after 20 minutes, you look away for at least 20 seconds, and you are looking at something far about 20 feet away. So you're using your computer now, you look away every 20 minutes. It's actually a lifestyle, and it's something that you can do if you practice properly. It really helps significantly for those who practice it consistently. It helps significantly in reducing computer, we call it computer syndrome. That is when you're having headaches, dry eye symptoms after using screen time for prolonged periods. It really helps. Anybody who is following me on iMatter with Dr. S, there's a video specifically on that explains it better. Then if you have dry eyes, a lot of our older populations here, they're using artificial tears for their dry eyes, because as you grow older, your eyes become drier, and so you need artificial tears to help you lubricate your eyes. If you are on that, please get your artificial tears, for the month. Use it as prescribed. If you're on anti-glaucoma medications, for those who are glaucoma patients, continue using your glaucoma medications as prescribed. Even if they say use 3 times a day or use 4 times a day, this does not deter fasting in any way. Don't say because it's Ramadan, I will just use in the morning and night. No, use as prescribed. It does not deter fasting. And then continue your follow-ups for your eyes, whatever it is, whether it's diabetic eye disease, glaucoma, just continue your follow-ups as you usually do. And so now let's talk about bad breath, halitosis. Now, we all know that fasting can come with some mouth odor, okay, as even evidenced by the hadith narrated by Sahih Bukhari and Muslim that said, by him in whose hand is the soul of Muhammad, the smell coming from the mouth of a fasting person is better in the sight of Allah than the fragrance of musk. This hadith just shows that Allah knows that there's going to be some mouth odor coming from the mouth of a fasting person. but this mouth odor is beloved to him more than musk itself, because he knows that you are fasting for his sake, and this mouth odor is for his sake. However, this mouth odor that comes from the mouth of a fasting person is a mild mouth odor. If you are having mouth odor during fasting and it is a mouth odor that is scattering everywhere, that one is not mouth odor from fasting. It is not mouth odor from fasting. We are all aware that oral hygiene is of paramount importance in Islam, as narrated by so many different hadith. One of the hadith by Abdullah bin Amr bin Rabia, narrated from his father, said, I saw the Prophet, peace be upon him, using the siwak while he was fasting so many times that I could not count. If we know the Prophet Muhammad sallallahu alaihi wasallam, we know that he was extremely meticulous when it comes to hygiene, whether of mouth or of body. He does not joke with hygiene, and anything that would make anybody say, something is smelling, makes him extremely shy. As there was this surah in Surah Al-Tahrim where his wives connived against him not to lie, may peace be upon all of them, but they told him that he was smelling of a certain substance anytime he went to visit his wife Zainab bin Jash. And the Prophet, because of that statement, the Prophet ﷺ swore never to eat or drink honey in the house of Zainab bin Jash. Because of that, the fact that something was just smelling made him so uncomfortable that he swore it off before Allah released the surah or Surah Al-Tahrim, saying that how can you prohibit what Allah has permitted? And so it just shows the Muslim Ummah how important hygiene is to our Prophet Muhammad sallallahu alaihi wasallam, and it's something we should mirror as well. There's also a hadith that says, were it not that it would be too burdensome for my Ummah, I would have commanded them to use siwak at every wudu and prayer. This also just to show or to reinforce the importance of oral hygiene in Islam. And there are so many other narrations about garlic, etc., etc. So halitosis is a huge problem. But what we should know is that halitosis, which is bad breath, can be from several organic causes. And it's something that we can do something about before Ramadan starts. There are so many things that can cause halitosis. Dental cavities. Some people right now, they have dental cavities that anytime they eat food, the food will just hide in those cavities and it will start smelling over a period of time. And it's not as if they have bad oral hygiene per se. They are brushing, they're doing what they should do. But those cavities are storing food, and at the end of the day, bacteria acts on them, and then it gives them terrible mouth odor, that is just beyond fasting. Okay? Tonsil stones. Some people, they have these tonsilloliths at the back of their mouth. Anytime they eat food, it packs at that back. There's a lot of tonsil stones that was accumulation of different foods on different days, and it gives them terrible mouth odor despite how rigorous they brush. They'll be brushing like there's no tomorrow, but they don't know. Give them 1 hour, that mouth will be stinking so these are things that can be done about. Some people with chronic sinusitis, people that are always having sinusitis, they can also have a particular smell that comes out from their mouth. People with reflux disease, even ulcer patients that are always having reflux of food back to their mouths. All these people can have mouth odor that cannot be explained by Ramadan, and it will really impact their self-esteem. So there's something you can do. Visit your dentist, visit the ENT, visit the gastroenterologist, depending on the cost, okay? Or if you just visit a doctor and they'll evaluate and refer you to the appropriate doctor, that would help, okay? And so these are all things that can make us very uncomfortable in Ramadan, and are things that fortunately, we can face head on before Ramadan starts. Okay, so thank you for your attention. At this time, I will be passing on the mic to my colleague, Dr. Aziza Brahima, a senior registrar from the Department of Community Medicine. These are the people that are really in charge of community medicine, health talk. Just talking to the community about things. They are the ones that really know how to engage the community on health health issues generally. So please let's welcome Sister Aziza Brahima.
Assalamu Alaikum Waramatullah Wabarakatuh. It is my honor and a great privilege to be in your midst this afternoon. I greet every one of us with the best greeting, which is the most acceptable and the best of all greetings. Once again, Asalamu Alaikum Warahmatullahi Wabarakatuh. Thank you. I will be taking over from where my colleagues stopped. I have a brief topic to discuss. I'll be very brief. The topic is basically is in relation to our mothers, women, especially during this Ramadan. Auzubillahi minash shaitanir rajim, bismillahir rahmanir rahim. So the topic before me this morning is pregnancy and menstrual abnormalities in Ramadan, an Islamic perspective. Pregnancy is a common word. We all know what pregnancy is. In fact, nearly we know one way or the other we have somebody that is pregnant in our midst. Maybe it's our wife, our sister, our mother, our aunt, our niece. Anyhow, you will have somebody, even if it is your neighbor, that is pregnant. So what do we need to know during this Ramadan? Then the menstrual abnormalities. This is so peculiar to we women, ladies. So it will be beneficial for men to listen so as to cascade the information back to their wives or sisters or daughters that are not here today. So what is pregnancy? Literary meaning is the condition in which a woman carries a developing fetus within her uterus. Layman word for uterus is womb. From time of implantation. Implantation is from time of intercourse of the fertilized ovum until delivery. That is pregnancy period. It's a common word. Then what is menstrual abnormalities? Before I go to menstrual abnormalities, I will explain what menstruation is. Although most of us will have known better. But let's just mention it. Menstruation is this monthly discharge, monthly blood discharge from a matured woman. It happens every month. So we have an adult or a child or a lady that attain menarche, that attain adolescent is expected to start menstruation at the age of, let's say, 11, 12. But nowadays we are seeing our children coming down, starting their menses at the age of 9-year-old. Probably it's the case of Gen Z or Gen Alpha that we are seeing. So, but at least average of 9 to 11, a girl should start menses. So that girl that is menses, what are we going to look out for to know which is the menstrual abnormalities? What are we going to see? What are we going to notice and conclude that this is an abnormal menstruation, especially if it comes up during Ramadan? So, menstrual abnormalities, they are the various deviations from the normal menstrual cycle. In terms of the frequency, we all know that the frequency is within 3 to 7 days. Some person will menstruate for minimum of 3 days, while some will go as far as 7 days. That is still normal. In terms of the duration, in terms of the regularity or amount of menstrual flow, we are going to break it into pieces for our mothers, for our sisters to take note of this. So next slide. So what are the common menstrual abnormalities? The first one I will say is amenorrhea. Amenorrhea simply means absence of menstruation. As I have explained earlier, I said a girl or a lady should start menstruating at the age of average of 9. Latest by 15, a female child must have started menses. But by the time there is no menses at the age of 15, it is abnormal. In fact, you will see our mothers, they start panicking at the age of 15, 16. You've not started, you start asking, nothing has come out, have you seen anything at the age of, because it is becoming abnormal. And that is what we call primary amenorrhea. Primary amenorrhea is when a child has never menstruated in her lifetime till age 15 years. That is primary, it has never occurred. Then we have what we call secondary amenorrhea. That is even common in our environment. That is when there is absence of menses for more than 3 cycles or 6 months. It happens in these early teenagers, and it happens in our mothers that are attaining menopause. That is, they have started menstruating, they know their cycle. At a time, or suddenly, they just notice, this thing is supposed to come on the 7th, 8th, 9th, 10th, the thing refused to come, that month has gone. The following month will come, the thing refused to come. The next month will come. So if it persists for the next 3 to 6 months like that, that is secondary amenorrhea, provided the person has not attained menopause. That is secondary amenorrhea. So in other words, secondary amenorrhea is it happens to somebody that has been menstruating normally and it suddenly ceases for the period of 3 to 6 months. That is secondary amenorrhea. So it is a concern. In fact, you will see mothers, this girl, even the mothers will be like, I didn't mean read. I don't know whether you get what I'm passing across. So that is secondary amenorrhea. It's a sign of menstrual abnormalities. The next one is dysmenorrhea. From the word dys, painful menstruation. This is common among young girls. Our mother will say because they are yet to be exposed. So painful menstruation, it is common among young girls. So we have 2 types of that as well. We have primary, which is as a result of pelvic pathology. Maybe there is something within the pelvic region. It might be as a result of trauma. It might be as a result of drug, a medication somebody is using. It might be as a result of genetics, because there are some people that their great-grandmother do experience painful menstruation. Their mother experienced it. They are likely to experience it. So these are the factors responsible for primary dysmenorrhea. That's primary painful menstruation. So the next stage is secondary. Secondary will be as a result of pelvic disease. That is, there is an abnormality within the pelvis. The first one, no abnormality within the pelvis. But the second one, there is something wrong, like endometriosis. Is a medical term, I'm so sorry. That is wrong with the pelvic region. So the next one I will explain is menorrhagia. Menorrhagia is excessive menstrual bleeding at regular intervals. It's simply described as using more than 5 pads per day. That is menorrhagia. On a normal day, on the average, you are not expected to use more than 3 pads, average 4 per day. But by the time you are using 5, 6, 7, that is every flow. That is menorrhagia. Is an abnormality, because it can lead to dizziness. You start feeling dizzy, you start feeling uncomfortable. You start feeling panting, because fainting attack as a result of excessive loss of blood. So the next one is metrorrhagia. Metrorrhagia is bleeding at irregular intervals between periods. Let me explain that. You are to see your menses on the 6th. The next one, you are expecting it later. If it is 28-day cycle, you are expecting it on the 4th, or within that 4 to 6 next month. But by the time you are now having another one on the 18th, that is bleeding at irregular intervals, which means you cannot really track your menstrual cycle because it's coming irregularly. That is metrorrhagia. So between periods, instead of you to see it next month on the 4th or on the 6th, you are seeing it on the 18th of this month. You cannot tell. So that is an abnormality. So the next one is polymenorrhea, menstrual cycle occurring at intervals less than 21 days. As I've mentioned, average is 28 days cycle, but there are some persons that they have 25 days, 21 days, some people even have 35 days cycle. So we concluded that our cycle should be between 21 to 35 days. But by the time you are now having menstrual cycle occurring at intervals less than 21 days, that is polymenorrhea. So next slide. So the next is oligomenorrhea. Oligomenorrhea is more than 35 days cycle. You are having infrequent menstruation. It comes this month, February. You didn't see anyone in March. It comes again early in. It's more than 35 days duration. So that's oligomenorrhea. Then we have hypomenorrhea. That's scanty menstrual flow. You will hear some persons will come to hospital. They will say, doctor, it's just drop per day. It's just drop. It is an abnormality. That is hypomenorrhea. That's scanty menstrual flow. Then we have menometrorrhagia. It combines both menorrhagia and metrorrhagia together. That is heavy and irregular menstrual bleeding. So, as I've said, I said minimum duration is 3 days, which is 72 hours, while the maximum duration is considered to be 10 days. Some people 7 days, 10 days. In some, it depends on individual. So we are going straight how it affects fasting. We are going to relate it to Ramadan. We are about entering this holy month. How we are going to take care of our menstrual cycle, our pregnant women during Ramadan. Having explained the meaning of menstruation, the disability, the abnormalities, and pregnancy, so we all know that fasting during Ramadan is fundamental obligation of all able Muslims. You are able, you are not sick, it is a must. Myself and you, we know that. And must be an adult Muslim, of course. We possess the physical ability to observe it. We all know that. But there are some conditions, especially we women, that prone us not to observe these obligations. As it is said in the Holy Quran, which my sisters mentioned, I was in Quran, Surah Al-Baqarah, Quran 2 verse 183. Bismillahirrahmanirrahim. Ya ayyuhallazina amanu kutiba alaykumus siyam kama kutiba alal ladzina min qablikum la'allakum tattaqun. Meaning, all you who believe, fasting has been prescribed for you as it was prescribed for those before you, so that you may attain taqwa, righteousness, elevation. That is divine elevation. So it is a must for us. But what are the conditions? When are we allowed not to observe these obligations as women? So, at the same time, Islamic law incorporates principles of ease and mercy. Allah is Ar-Rahman, especially for we women. Ar-Rahman. He gave us a whole surah in the Holy Quran. He considers us in all bits of life, in all ramifications of life. Women are being considered favorably. So, granting exemptions in circumstances where fasting may cause hardship for us or harm during pregnancy or during menstrual irregularities. So, menstruation in Ramadan. As I have explained before now, I say menstruation is a natural biological process. To some people, menstruation is a disease. No. Menstruation is a physiological phenomenon. It's a normal thing that has been ordained by Almighty Allah, Subhanallah wa ta'ala. It is, if you are not menstruating, you should be panicking, because Almighty Allah ordained us to undergo this. So, is an Islamic jurisprudence unanimously holds that a menstruating woman is exempt from fasting. Yes, as we all know, there are, if I can remember, there are 5 things that we must stay away while menstruating. Number 1, a menstruating woman must not pray. We all know that. Almighty Allah forgive us. You are free. You are not going to that 5 daily prayers. You are off when you are menstruating. The second one is Ramadan. During Ramadan, there is no fasting for a menstruating woman. Then the third one is, I think, a menstruating woman should not do tawaf. When the person goes on Hajj or so, you must not do tawaf. Then the fourth one is, I think, no sexual intercourse during menstruation. While the last one is plus or minus. According to some scholars, they said a menstruating woman will not carry Quran or read from the Holy Quran. That one is, there is a sort of controversy there. Some scholars say it's allowed, some say it's not allowed. But the first four, it is a must. A menstruating woman should not go, which we know that fasting is one of these key points. So the ruling is firmly grounded in the Sunnah of the Prophet Muhammad sallallahu alaihi wasallam, who stated that when a woman menstruates, she does not pray or fast. It was brought by Sahih Buhari. So, but missed fast due to menstruation are to be made up after Ramadan, as narrated by Aisha radiallahu anha. She said, we explained that women were commanded to make up fasting, but not prayer. As women, we fast. We don't pray while menstruating. We don't fast while menstruating. But we are allowed not to repay the fasting, but then we are allowed not to repay the prayers, but then we are allowed to repay the fasting. So the decision reflects a legal balance between obligation and physical capacity. Because Almighty Allah knows that as a woman that is menstruating, you are losing blood. Only God knows the amount of blood that is coming out of your body. You are being weak. Some persons during that 5 days, there are some staffs, there are some women that they don't go to work. They take off days during their menstruation. At least for the first 2 days. I know some people, they don't come to work for that day 1 and day 2 as a result of dizziness. They are feeling unwell, weakness. Some people even faint. Some people land in hospital nearly every month or every 2 months. So Almighty Allah realized and I said, oh, these people should be away from fasting and prayer. But we have to repay fasting. It's only prayer we are to go with. So menstrual abnormalities known as istihada, that's either irregular or non-menstrual bleeding, are treated differently in Islamic law. I want to go into that. I mentioned that if you are menstruating, average of menses per month is 3 to 10 days. Some people 7 days, some 10 days. By the time it is going to 12, 14, 18 days, it is no more menstrual. It is no more normal menstruation. It is as a result of an abnormality that is taking place. So such bleeding does not carry the legal rules, the legal rulings of menstruation, and therefore does not invalidate fasting. So it is said that after day 10, you know that my normal days is 5 days. On the 6th, it refused to stop. 7, it refused to stop. It is said that we resume our fasting on the 8th days. That is no more menstruation. That is abnormalities. It's a result of an abnormality going on in the system. So the Prophet has clarified this, sallallahu alaihi wasallam, clarified this distinction by stating it is only bleeding from a vein and not menstruation. It was narrated by Sahih Buhari that excess bleeding that is coming out after our 7 days normal menses, it is from a vein. It is not menstruation. So we are allowed to go back to our fasting or to go back to our normal prayers. So this is a fact that consequently, women experiencing abnormal bleeding during Ramadan are required to continue fasting and perform other acts of worship like praying, tawaf, and other things. So that that is menstruation. So pregnancy in Ramadan, I will be brief. They are telling me a few minutes time. Pregnancy introduces another context in which Islamic law prioritizes health and prevention of harm. So, while pregnancy itself does not automatically exempt a woman from fasting, it's not that, I am pregnant, I'm not going to fast. No, it is not written anywhere. But then, Islamic jurisprudence allows pregnant women to refrain from fasting if they fear harm to themselves or to the fetus. If you know that, let me crack small joke. I saw a woman, I'm sorry please. I met one of our mothers advising a lady that is going into marriage. They were now advising a young girl going into marriage that, hope you are not owing any fast. You better go and clear your fast too, because it's likely in the next 3-4 years you are not going to fast. I was like, does marriage stop us from fasting? But by the time I met the lady, 4 years after, the lady was telling me that, doctor, for the past 4 years, I have not been fasting. I said, why? He said, when he entered matrimonial home, that year, he got pregnant. The following year, he was breastfeeding. The third year, he got pregnant. The fourth year, he was breastfeeding. I said, if care is not taken, you will need to you understand what I'm saying? So Almighty, and I asked her, does that mean you are not fit? She said, anytime I'm pregnant, at times I land in hospital, I'm not fit to work. I said, okay, fine. Almighty Allah has excused you, but there are certain things we need to do to compensate for this. So, because as women, if you say you are strong, there are some persons that have tried it during pregnancy. I'm strong, I can do it. We realize at the end of the day, around 2 o'clock, they start feeling dizzy. They say, it remains just 3-4 hours now. I can complete it. Around 4, realize that no, you can't continue. That's even while breastfeeding. When your child, maybe you have a baby that is breastfeeding, and you are doing exclusive breastfeeding. The child is sucking and sucking, and you are fasting. What do you expect this child to feed on? So Almighty Allah has excused us from fasting at this period, but we have to repay back. If we are not going to repay by fasting, there are other things. There is something we call fidya. Fidya is you feed fasting people. You know that, I'm pregnant, I'm breastfeeding, I can't fast. But I have a neighbor that is of less privilege. Something. Your sahur and your iftar for the next 30 days, MashaAllah, Almighty Allah will handle it. Directly or indirectly, you are paying back your fasting, and you are breastfeeding your baby. You are enjoying your pregnancy. So, Almighty Allah has given us that rahmah. So, while pregnancy itself does not automatically exempt, there are some people that are capable. If you leave them to fast for the next 30 days with pregnancy, they will do perfectly well. Even be stronger than people that are not pregnant. If you know you are strong, this is within you and Almighty Allah. If you know you are strong, you can do it. Fine, you go ahead. But if you know you cannot, no matter the 1,000 of talks, I get pregnant, I get belly, you stay away from that pregnancy. But you compensate by doing fidya, or you have it at the back of your mind that after delivering this baby, I have to go and repay my fast. And there are some persons, I also learned this from our mothers. If they are pregnant, they will not want to lose the whole 30 days. They either fast today, skip the next 2 days, instead of losing the whole 30 days rahmah. So whatever works for you is what you take. You know yourself. Sincerely, you work with it. Almighty Allah help us. So, as I have said, Allah is the merciful, Ar-Rahman. So the concession is supported by the prophetic statement. Allah has relieved the pregnant and breastfeeding woman from fasting. Is an hadith. And missed fasts are generally required to be made up at a later time when the woman is able. So it can be in form of repaying back the fast or doing fidya, feeding the less privileged people. So in conclusion, Islamic ruling concerning pregnancy and menstrual abnormalities during Ramadan demonstrate the flexibility and compassion inherent in Islamic law. It is flexible. Islam is a pleasant religion. By accommodating physiological realities, they know what we are passing through as women during menses and during pregnancy, while preserving religious obligations. For the fact that you are pregnant, that doesn't mean you should not benefit from what others are benefiting. So Islam ensures that fasting remains a means of spiritual purification without compromising physical well-being. So may Almighty Allah accept it as an act of ibadah from us. And I wish every one of us Ramadan Kareem in advance. Jazakumullahu khairan.
Jazakumullahu khairan, Dr. Aziza Brahima, for that comprehensive presentation. I think in summary, she has mentioned that women have different thresholds. At the end of the day, sincerity is important. Know yourself. Know the extremeness of your situation. Know how far you can go. And sincerely, between you and Allah, this is about you and Allah, not you and what somebody is thinking about, what you can do or not. Between you and Allah, know what you are able to do, and then do the best you can do during Ramadan. Jazakumullah khairan once again. And so for the next leg of the presentation, I'm going to be inviting Dr. Faith Walgbe, a senior registrar in internal medicine from the University of Port Harcourt Teaching Hospital, to speak to us about diabetes and peptic ulcer disease in Ramadan. She's a specialist in that area and will do her best to expatiate on these topics. All right, Dr. Faith, you have the floor.
Good afternoon, everyone. I appreciate the Imam and the organizers of this program. It's a privilege to be in your midst. Thank you so much for having me. I'm Dr. Nwobe Faith, an endocrinologist with UPTH, and I'll be talking on management of chronic disease in your Ramadan fasting, with special emphasis on diabetes and peptic ulcer. What is diabetes? In the layman's term, diabetes is a condition where you have excess sugar in the body that the body cannot handle. It's a very common disorder. It's very much with us, and it's quite common. What actually is the cause of diabetes? In the normal human body, the body produces a hormone we call insulin that helps us to absorb sugars. What actually is sugar? Sugar is actually gotten from what we eat. Our carbohydrates, our proteins, fat and oil, they are broken down to the form of sugar. So a diabetic patient is not just one who drinks sugar in what we all know, but whatever we take in, the final end product is sugar. So a diabetic patient has problem with absorbing sugar. There are two types of diabetes. There is the one that affects children and the one that affects adults. The children own is the type we call type 1 diabetes. There are two main types, although there are other several types. The type 1 diabetes is the one that affects young children. That type, they are dependent on insulin. Insulin is what the body produces. It's a hormone or a metabolite that the body produces to help us to absorb sugar. Without insulin, we cannot absorb sugar. The type we find most commonly in the adults is the type 2 diabetes. That one is not dependent on insulin. So your body is producing insulin, but that insulin cannot work in the body. The body is resistant to insulin. So that's the type 2 diabetes. We also have a type that affects pregnant women. That's called the gestational diabetes. So diabetes is very much with us. So we should be able to know how to live with it during this Ramadan fasting. Most people consume 2 meals during the month, during this fasting that we're about to enter. One before dawn and one after sunset, when you break your fast. We should know that fasting is not meant to create hardship on the body. For people that have diabetes, there are types that cannot, there are some type of diabetes, there are some conditions that they have that they cannot fast. So we should be able to know that it's not every diabetic patient that can fast. Some can fast, but not all. So we're going to be talking about those that can be able to fast and those that cannot fast with the next few slides. It's very important that any patient that is diabetic to monitor their self. And how do you know you are diabetic? There are some symptoms that you may have as a diabetic. When you are urinating too much, you are drinking too much water, you are losing weight. These are some of the common symptoms of diabetes. When you have this complaint, you should see your health practitioner to run some investigations for you and to make that diagnosis. So once you are confirmed that you have diabetes, once you enter into the Ramadan period, you should have your glucometer at hand. A glucometer is something we use to monitor our blood sugar. It's a machine that used to monitor your sugar. So any person that wants to fast during the Ramadan period, we should have our glucometer at hand. That's if you are diabetic. Please, it's very important because you need to monitor your sugar. Because during this fasting, your sugar can get very, very low, which is dangerous, which you don't want, or very, very high. So it's very important. So we should know that it's not one size fits all. We have to actually individualize each and every one that is diabetic. What do I mean by that? You need to see your doctor to actually adjust your medications based on your fasting. There are some people that are just on tablets, just one tablet. They are doing very well. Their sugar is well controlled just on one tablet. There are some that are on 2 medications, 2 tablets. There are some on 3 medications. There are some even on with insulin. Those on more than 1 medications with insulin, we don't really advise them to fast. But if you are just on 1 medication, your sugar is very well controlled, yes, you can go ahead and fast. So you need to actually consider yourself. Which picture do I find myself? Is my diabetes controlled? My diabetes well controlled? When I've been seeing my doctor for the past months, and my doctor told me that yes, my diabetes is controlled. So you need to actually sit out with your physician. What are some of the danger signs in diabetes? There are some signs you see in diabetes when you are fasting that you need to, they are called red flags. Once you see these symptoms, it's a symptom for alert. Excessive sweating, shaking, feeling of dizziness, feeling of fainting when you are fasting. Please, in those symptoms, you need to check your sugar and you need to abort the fasting. Please, they are what we call danger signs. I'll be talking on tips for the diabetic during fasting. What are the tips? Firstly, you need to know yourself. Are you a high risk person or are you a low risk? Low risk are those that are sugars have been well controlled. They know their diagnosis. They have been seeing their doctors. They are on drugs and their sugar is well controlled. If your sugar is well controlled, you can go ahead and fast. You are low risk category. Please change the slide. You are low category. But if your sugar is not well controlled, you are taking insulin, you are taking so many medications, your sugar is not well controlled, you are under high risk. Please, you cannot, we don't advise you to fast. As a doctor, we don't advise you to fast. So you need to plan your meals around your fasting period. You need well planned and balanced meals for diabetics. When you break your fast in the night, you need to stay hydrated, drink a lot of water, avoid sugary drinks. It's not a time for you to say, I've been fasting since morning, now I'm breaking my fast. You want to start drinking sugary drinks. For a diabetic, we avoid it. But if you're a normal individual, you can go ahead, but avoid sugary drinks when you are breaking your fast, because they can increase your sugar so high in the night. You think they are doing you good. That next morning, they can actually cause some complications. So you want to avoid taking sugary drinks when you are breaking your fast. You can exercise when you are fasting, but moderate exercise, not high intensity. It's not a time to start doing the type of exercise that your body is not used to. Moderate intensity exercise. It's very important that as a diabetic, you need to adjust your medication. How do you adjust your medication? Is by seeing your health practitioner. Because you are taking less food. So your drugs that you were taking when you were eating normal, you have to reduce your drug so that you don't enter what we call low blood sugar. So your drugs need to be adjusted. I'm talking of those in the low risk category who have well controlled sugar. They have been doing well with their appointment. Now it's time for fasting. Your drugs need to be adjusted. They need to be reduced based on your blood sugar. When do you break the fast? Immediately. There are some symptoms you see that you need to break your fast for someone who is diabetic. I said some of them earlier. When you are feeling confused, you are sweating, your hands are shaking, you don't know what is happening, you just feel like everywhere is becoming dark. Please, you need to break it. Severe sweating, severe stomach pain, you need to break it. Breaking of a fast is allowed in Islam. So you are not breaking any rule. It's allowed due to health circumstances. So I'll be going further to... Please, can we change the slide so that they can follow us? I'm in ulcer now, peptic ulcer, patient with peptic ulcer. Please continue. Yes, thank you. So ulcer is another very common illness we find in several patients. Peptic ulcer. It's a condition when everybody has peptic ulcer. Everybody has acid in our intestine that helps us to digest food. Whatever you take in, this acid in your intestine helps the food to be broken down. Without that acid being present, you cannot digest food. But we find that in patients that have peptic ulcer disease, there's an excessive secretion of the ulcer, of the acid, number one. Number two, their body is very sensitive to this peptic acid. So some people can stay, they have the same acid, but they are not sensitive to it. But some people, they are very sensitive to it. In such a way that it starts eroding the inner lining of the intestine. So these are the group of people we are talking about. How do we fast when you know you have ulcer? Next slide, please. So those that have active ulcers, so there's active and inactive ulcers. Those that have active ulcers should avoid fasting. What do I mean by active ulcers? You have pain in your upper part of your tummy, hot burning pain usually occurs, intense, sometimes they pass dark stools. Their stool is dark. Normally your stool is not supposed to be dark, it's supposed to be brownish or yellowish. When you are passing dark stools without eating vegetable or without eating anything that can color your stools, you pass dark stools, it means you are bleeding internally. It means your ulcer is active. Please see your doctor. You should avoid fasting. Or some people, they are taking blood tonic. It can also cause dark stools. I'm not talking of those group of people. So those who have active ulcers, severe chest pain, some people, their own is in between their breasts, the midline, that place is always burn, it's always hot, it's always peppery. That is an active ulcer. Please, you need to see your doctor. But those that have healed ulcers, maybe you have had ulcer in the past, you took drugs and it healed, you are asymptomatic. In that condition, you can fast, but you don't have any symptoms. You can fast, but you should be careful. You should be on your ulcer medication, because when you are fasting, that inactive ulcer can go and be active. So you need to be careful. So there are drugs that we give to suppress acid secretion. So you need to be on it while you are fasting. So those that have inactive ulcers can fast under medical supervision. There are some people that have what they call heartburn. I've described it. It's like your heart is burning, peppery in between your chest. Please, you have to be careful. Patients with ulcers, how do we manage it? When you are breaking your fast, avoid eating fatty diet. Avoid eating diet that contains gas, such as Coke, all these our drink, carbonated drinks, energy drinks. Most of them contains gas, and they can trigger your ulcer. So when you are breaking your fast in the evening, please avoid drinking coffee or soda, avoid smoking, avoid spicy diet, spicy food. So when you are breaking your fast, you break your fast, you start with light meal, fruits. From there you can now go into your main meals. Please avoid carbonated drinks and the rest. Some of the tips for patients with ulcers. It's important to note that when you have ulcer, you have diabetes, you have hypertension or other chronic medical condition, please don't stop your medications while fasting. You can still take your medications while fasting. I talked initially that patient with diabetes, you need to adjust your medications. If your diabetes is well controlled, you need to reduce your medications while fasting. Please see your physicians. Those with blood pressure, hypertension, please continue your BP drugs. BP drug does not depend on food. Whether you eat or you don't eat, or you can be on your BP drugs. So when you wake up in the morning, before you start your fast, you can take your BP drug. At the end of the day, if you are on morning and night drugs, you take your drugs after breaking. So please, high blood pressure patients can take their BP drugs. Even in the afternoon, if your medication is morning, afternoon, and evening, you can take your BP drug. It does not require food. Please, let's take notes. Safe practices. If you have been cleared to fast, you should be on anti-acid suppressant drugs. At iftar, when you are breaking your fast, you should take your drugs. And at sahur, you also take your medications. You break your fast properly. I've said that before. Complex carbohydrates. Carbohydrates that increase your blood sugar for patients that are diabetic. Please, you want to avoid that. And I've talked about that. Avoid eating heavy food, heavy diet. Don't use heavy food to break your fast when you have ulcer. You are taking pounded yam, swallow. Eat it little by little. Don't go and download one heap of full plates at once. Break it little by little. Okay, you can eat after 1 hour time, you top up again if you have ulcer. But if you are normal, you don't have any problem, you can eat the way you want to break your fast. Don't overdo it, please. For patients with ulcer, we advise before you go to bedtime, your last meal should be about 2 hours before bedtime. Why? Because if you eat very close to bedtime and you lie down, the food can go up, what we call acid reflux. The acid in your stomach can start going into your throat side, and it can cause heartburn. So you want to eat about 2 hours before you go to bed for your bedtime. Avoid food that contain lots of fat, lots of gas. I said that. Avoid certain fruits. If you are an ulcer patient, food that contain acid, pineapple, they contain lots of acid. Please avoid it. Vitamin oranges. For ulcer patient, you avoid it. You can take cucumber, watermelon, cabbage, salad. You can take those ones, but avoid food that contain lots of acid. Avoid drinks containing soda. I've talked about avoiding alcohol, citrus food, full cream milk. Avoid food that are difficult to digest. There's some food that are difficult to digest, like taking snacks at night, beans, things that contain gas. When people, they note that some foods stimulate their gastric secretion, their acid secretion, like beans, moi moi. For those people that when they take beans, it affects them, please avoid it. But some people, when they parboil their beans, when they pour that first water, it helps relieve the gas in it. So depending on what your body can withstand, you should know how to adjust your meals. In summary, who should not fast? People that have very low sugar. I said we should have our glucometer with us. Those that are diabetic, your sugar is always on the low side. Please, it's very important to watch your medications and avoid fast. Those that are on insulin injection, I told you that there are two types of diabetes. Those that are dependent on insulin, those are type 1 for children. They are on diabetes insulin injection. Please, they are not advised to fast. Then the type 2 diabetes that is not dependent on insulin, but there are sometimes your doctor may add insulin for you. In those instances, please, you avoid fasting. Those having active stomach pain or bleeding, vomiting blood, passing dark stools, please avoid fasting. Vomiting or severe weakness, they can avoid fasting. What can you do instead? As my sister already said, you can feed the poor. There are things you can do during this Ramadan period. You can send money to feed the poor. I've come to the end of this presentation. Please, if you have any question, the floor is open. Thank you.
Okay, thank you very much, Dr. Faith, for that comprehensive presentation. I just wanted to conclude by saying that she has mentioned so many things about diabetes and peptic ulcer disease. And as a Muslim community, I feel like our health-seeking behavior is still lacking. Perhaps because of certain parts of our doctrine. Muslims, we believe that Allah is able to do all things. La ilaha illallah wahdahu la sharika la. Lahul mulk wa lahul hamd wa huwa ala kulli shayin qadir. There is no one worthy of worship but Allah, alone and without partners. His is the dominion, and His is all praise, and He is able to do all things. This is our doctrine, and a very valid doctrine. But, we still have to do what we should do, what we must do. Allah has already said Muslims should tie their camels. We know He is able to do all things, but we must do what we need to do first. I know so many Muslim diabetics that have not stepped inside the hospital. They have not stepped inside the hospital out of this doctrine that Allah is able to do all things. Black seed. That is not Islam. That is not Islam. You have total faith in the ability of Allah to solve your problems, but you must do what you need to do first. You must. We have people with, I did see somebody with very bad diabetic eye disease, and I told this person, I said, this eye disease is progressing very, very fast. We have to start you on injections, because there's a certain type of diabetes that when we, diabetic eye disease, when we see, we have to start injections before that person gets blind. A lot of eye disease progress over time. It doesn't just happen once, but when it happens, it will be too late. Our eyes, the way our eye metabolizes things, it is always too late when you wait for the thing to happen. Once it happens, you are now coming to the hospital. There is nothing. They will be holding your hand and be leading you, and there is nothing we can do. Up till today, I have not seen that person. That person is doing wa huwa ala kulli shayin qadir, and I have absolutely no doubt that Allah can do all things, but that is not the right way to go. Do what you must and have faith that Allah would, or your effort, Allah will crown that effort with success. So that is just to end the note of everything she has said. Jazakumullah khairan for listening, and I'll be passing over the floor to our Professor Brahima.
Alaikum Waramatullah Wabarakatuh. I want to thank our speakers for your lectures. You have given us good tips, good measures, good action that we need to take in the month of Ramadan. But let me quickly state that all these admonitions are not just for those of us that have this condition. Even those of us that assume that we are healthy, these are things we need to take note of. Thank you. These are things we need to take note of. When you are fasting, you experience any of these things that have been described. You don't hide under the pretense of the fact that I'm not diabetic, I'm not hypertensive, neither do I have peptic ulcer diseases. Because you are fasting, like we said, you can experience any of these symptoms. Your blood sugar can become very low when you are fasting. You could have chest pain, and all that due to gastric reflux or acid burn. So these are indications that you need to take action by breaking your fast. I want to quickly also state that in Islam, because I know when our speaker mentioned it, we all reacted, yes. In Islam, we don't take drug in the during the day. So if you are on drugs, you can take your morning drugs and you can take your evening drugs. But you cannot take drugs during the day with water. Once you do that, you have broken your fast. So your drugs, those are one of the measures we can take. Those of us that are on 3 times a day, 4 times a day drug can be moderated to twice a day so that the afternoon drug can be removed. Even those of us that are on other forms of drugs, antibiotics, it's advisable that antibiotics that are twice daily regimen are better prescribed for us when we are fasting than those that have other frequency, 3 times or 4 times a day, as the case may be. So we want to thank our presenters. They have done justice to this topic. We have always done this. This is just a reminder to us so that we can begin to prepare ourselves for the Ramadan that is coming. So at this point, if we have any question, we'll be glad to have them so that they can be those confusion, those things that are causing, that we quite do not understand, can be addressed. So thank you for your time and thank you for listening. So number 1, number 2, number 3, number 4, number 5. So we'll start with let's give preference to our women. So we'll start with Aja at the back. Alaja Taiwo.
Ross, don't give them. You just sit down for them.
No, the one. Okay, please, you can just note the questions so that we can answer after the questioning.
Assalamu alaikum Ramadan Wabarakatuh. I need some of the lectures, especially that of Dr. Azizat. Thank you very much for the information. What I want to say is, as you know, in diabetes, we have fruits that have high glycemic weights, like mango, and some of us like it very well. But maybe it's not really a question, but what I do is I love eating mangoes, you know, and like maybe I'm type 2 diabetes and everything. But with the mango, I take it with cucumber. You can maybe do the smoothie with cucumber and everything. Then again, in terms of taking of the medication, because these days my blood sugar drops very, very fast. So I know my glucometer is always in my bag and around and everything. So when I'm fasting, I normally don't know, I don't have appetite for food for Salau, but maybe sometimes I might take coke out, you know, or I take banana. The banana has a high sugar glycemic rate, and that can keep me for the whole day till maybe when I'm getting to 6 o'clock. That's when I will start feeling a bit dizzy, like, look, it's time I break the fast. So like what I want to emphasize now is knowing your blood sugar level. If your blood sugar level is one that drops every time, anyhow, banana helps. Banana helps to keep it at a certain. I don't know the science behind it, but I know it helps a lot to keep it. But maybe a mixture of banana and mango. Assalamu alaikum warahmatullahi wabarakatuh.
My question is on the malaria and that of the malaria. Does malaria really come with typhoid? Because you find it is a common practice that when you have malaria, you'll be given drugs for typhoid. So I want to know. Then secondly, I want you to shed more light on that menstrual abnormalities. That's when you're feeling severe pain, especially to our young girls. What should be done? Thank you.
Yes, let them attend to the women.
Okay, attend to the women. Okay, the comment on banana and dietary control. Yes, banana has a very high glycemic index. Like you said, your sugar is a bit controlled. It's even going towards the low side. So you can supplement with bananas. But a patient that has poorly controlled blood sugar and feeds on bananas, it's not really advisable because it will shoot up the sugar to be very high levels. And that can even enter very high, what we call hyperglycemic emergency. So we don't advise it. If you take banana, one finger, but not the people eat like 4 or 5 fingers, no. Because it can shoot up your sugar. So you know yourself, you are controlling your sugar, you have your glucometer at hand, so that works for you, but it's not, you cannot generalize it. Thank you for the comment.
Okay, so let me answer the question on the malaria and typhoid. You mentioned that when you have malaria, they usually give you typhoid medicine. See, this typhoid thing is a very controversial topic between us medical practitioners and patients and the community in general and the labs. The labs just want to make money, because typhoid, what we know as typhoid, is a very serious illness, and it's not something that is always happening up and down. No, typhoid is a highly infectious disease caused by an organism. The diagnosis of that organism is through microscopy and sensitivity of your stool, your poo-poo. So this one that you go to lab, they'll just do one blood test and say, why that test? Typhoid. Is not what we know as typhoid. It is overdiagnosed and it is wrong. These people just know that Nigerians like to hear typhoid. You have typhoid, whatever it takes, I will pay. It is not correct. That Widal test is outdated, it is wrong, it is not true. Whatever positivity it is saying, it is not true. Labs want to make money, and they have made a lot of money from, lying to the public that you have positive Widal test, you are typhoid, kinikon. If you have typhoid, your fever will be like 42 degrees Celsius. You will be shivering, you will be vomiting, you will be stooling. It's a very highly infectious disease. It's not something that you just be, I have slight headache. Oh, it's malaria and typhoid. That's not typhoid. Oh, that's not true. It can just be malaria. You use your anti-malaria. It can even be stress. I think it's just people going to the wrong places for diagnosis. If you want accurate diagnosis, you should visit a healthcare, not pharmacy, not lab. Because those ones want to sell their markets. And they will do whatever it takes to sell their markets. Pharmacy, oh, you have a headache, use Paradol, use ciprofloxacin, use this, use that. You will be fine, But they have over-treated, over-killed. They have not made the right diagnosis, and you've been led astray. So for you to get correct diagnosis, go to your doctor, let them do tests. full blood count, whatever it takes. If they actually suspect typhoid, you're vomiting, you're stooling, you have all the symptoms, they will send you for a proper typhoid test, which is your stool. They will look at it under the microscope and actually diagnose typhoid. And that's when they will now treat you for typhoid correctly. Okay, but malaria is endemic in our society. A lot of people can have malaria symptoms, but still it is still over treated in this our country. Everything malaria. Sometimes it's not malaria, it's just stress. You sure you understand? So I think we as Muslims, we should just do the right thing. You are having some, I know that everybody hates hospital. Everybody wants shortcuts to heaven. Nobody wants to go to hospital. Oh, hospital are their wahala. Let me go to pharmacy. Pharmacy will just sell their markets. Lab will just sell their markets. Nobody is telling you the truth. It's only when you get to the hospital, the doctor would run appropriate tests and, you know, tell you the truth and treat you correctly. So that's just the thing on malaria and typhoid. It's not as common as you are saying. And it's not, you know, everybody that comes malaria and typhoid, okay? So that's just what it is.
Assalamu alaikum. As a follow-up to that, you see, most times, nobody gave you a diagnosis. You gave yourself diagnosis.
Exactly.
You go to a pharmacist or you go to a pharmaceutical shop. When you get there, you say, doctor, typhoid and malaria. That's what you tell them. And because the man too wants to sell his drugs, you say you have typhoid and malaria, he will give you something. You will take for the typhoid and malaria. So these are conditions that Muslims must take. That must be treated based on diagnosis. There must be diagnosis, not that I'm having headache and you assume that it's malaria. No. You can actually be misled, but we always put ourselves in that position to be misled. I'll give you an example of what happened about 2 weeks ago to the lady that is teaching my daughter at home. At night, around 9 a.m., 9 p.m., thank you, she called me and said, and she was crying. When you say crying heavily, she was crying heavily. She called me. The younger brother is dying. The brother is very sick. They brought the brother from the village and all that. They said the PCV is 8%. So as soon as they said the PCV is 8%, and they have done a scan, and they said the boy has a congenital heart disease. So as far as the girl was concerned, the girl was, even when she has not seen a doctor. It was my wife she called, and my wife rushed to bring the phone for her. I said, first, saying a PCV of 8%, first, I said, that is not correct. Because you have to be in the profession for you to understand. PCV of 8% and all that and all that. I said, okay, but in any case, if you can calm down. And they came down immediately. I collected the scan result. As soon as I collected the scan result, I looked at it. And I told her, it was signed. They put signed by a consultant radiologist. I can tell you the bad things that are happening. It was signed consultant radiologist. So when I read the scan, I told her that this scan result was not even written by a doctor, not to talk of a consultant, because of the terms that have been used. I look at the child. Obviously, this child that is suffering from chronic malaria. Chronic malaria, apparently, there is anemia with heart failure. Anemia with heart failure. That's the way I looked at it. But in any case, as we were talking, she was darting all over the place. I said, cool down. I immediately called my friend, a professor of radiology. I said, he said, send the result to me. I sent the result to him. He called me, he laughed. He said, Prof, just as you said, this is not written, it's not a radiologist. I said, I know. And all that. I said, but in any case, I'm not a pediatrician. I took them to I said, okay, come to the house. They came and I took them to the clinic the next day. Behold, the professor, the pediatric surgeon, pediatrician, he started laughing. We talked at everything. He said, Paimon, this is a case of anemic heart failure. In fact, the child was told to go and do tests now. And now discovered that the child is now having acute kidney injury. Meanwhile, he has gone to a private lab. They have paid 30,000. They have told them to go and look for 3 million, 4 million for surgery and all that. So at the time she has done all this tests, she had even finished all the money with her. So at the time I took her to the hospital, I have to take responsibility for all the payment. And they did test and nothing was wrong with this child other than chronic malaria with anemic fever. So the child, and she was with pneumonia. There was complication of pneumonia. So this child was just placed on antibiotics and anti-malaria. By the third, by the fourth day, the child started playing around. And by the next week, gave them 1 week appointment. They went for it, and the child was okay. So there are a lot of these issues out there. So let us not be reluctant to go to the right place. There are so many people out there that they are qualified in their own right, but they are not qualified to do what they are doing. They could be lab technologists, they could be scientists and all that. They are not taught the art of diagnosis. So when you have a problem, go to a doctor. And that is why most times you end up going to the pharmacy, you spend all the money in the pharmacy, you spend all the money in the traditional setting, you spend all the money in other places you go to. And at the time you are coming to the hospital, the situation is already beyond control. And you now want the doctor to perform magic. So these are the challenges we are having. Seek medical advice, seek medical intervention where you have problem. Everybody in Nigeria has typhoid and malaria. So we should not allow that to bother us, and there is nothing like that. Thank you very much. So the issue of menstruation.
Yeah. On the issue of severe pains during Ramadan, during fasting, right? It depends. If it is a young girl, which is common amongst them, of course we all know that during menses we are not allowed to fast. So you give all available medications you've been given. You break the fast instantly. She cannot fast, so you give everything givable at that point. But I think where you are directing the question is what are we to give, if I'm correct, during severe pain, that's dysmenorrhea. First and foremost, even before our menstrual cycle, it is not advisable that we consume, as women, that we consume more sugary things. My sister mentioned it that we should do away with carbonated drinks, I guess. I know some persons that they can't do with Coke, Fanta on a daily basis. So these are the things we need to be moderate on, even before our menses. Then when menstruation comes and it starts with severe pain, the pathophysiology is that there is an hormone in our system which is called prostaglandin. The prostaglandin is responsible for the contraction of the uterus. That is what is resulting to the pains. So what are we to do? There are some conservative managements that we do before we go to medications. Number one, let the person be at ease. Lie down in a well-ventilated room. Let the person be at ease. The room should be well ventilated. If there is AC, if there is fan, you can open the window so that at least the person will be relieved. If the person is wearing tightened clothes, any tight-fitted clothes, allow the person to ease off the clothes. So it is advisable that you take warm fluid. If it is water, tea, some person can go for pap. All these are conservative management that we can do to be able to withstand that prostaglandin secretion effect. That is the contraction of the uterus. It's just like the hormone is secreting, contracting the uterus for the blood to come out. That is the literal explanation for that pain we used to experience during that time. So, and because of that excessive secretion of hormone, that is why medical practitioners will advise go for analgesics, mild analgesics. We don't use sledgehammer to kill mosquito. If there is mosquito on the wall, you go and carry sledgehammer, you kill mosquito. Yes, we are going to kill mosquito, but you will break the wall. And that is what my sister explained that other time. You are having ordinary malaria, they are giving you Cipro, giving you all sorts of drugs. You are using sledgehammer to kill mosquito. Your mosquito will die, but then you will crack the wall. So in that case, prostaglandin is secreting. We want to control the rate at which the prostaglandin is, because it must secrete. The blood must come out. So we now give mild analgesics as little or as much as. Some people go for paracetamol, some people go for ibuprofen. Just mild analgesics. But please and please, don't make it a routine. Some person, even if it is not, they will say, I had it on Sunday. They said if you are having anything severe pain in your tummy, go and take ibuprofen. They start taking this ibuprofen every week. No. It is only and only when necessary. And that is why I'm laying emphasis on our young girls. Let me tell you the effect. The effect is it will go and block the excessive secretion of the prostaglandin, and we need this prostaglandin for the uterus to keep contracting every month. So by the time you are taking excess of these analgesics, it affects the secretion of the hormones. So I personally will advise people, instead of going, and all these our drugs, paracetamol, ibuprofen, they have their own side effect too. In fact, to me, medication is the last option. There are several things we can do before we go into drugs, and that is why I hardly mention drugs to people. There are certain things you can do to be okay, to keep fit before medication, before drugs. So I think this is, and as I was saying, I'm laying emphasis on our young teenage girls, because they are the one experiencing this. Our mothers, they are not experiencing this like our young girls. So please and please, don't use this medication to crack their wall with the intent of killing the mosquitoes. Thank you for listening.
Okay.
For our men.
I should not say going.
Yes, those of us who want to ask questions on this side, start from here.
Assalamu alaikum.
Walaikum salam.
My question is just very brief one. If someone is on medication at least 4 times in a day, during Ramadan, as you said, maybe 2 times it's available now, can it double the dose? Assalamu alaikum.
Let me just quickly dispel that. You know, it's not issue of quantity. The duration, the interval between administration of drug is very important. If they say you should take drug 4 times a day, it means that that drug can be in the system for 6 hours. After 6 hours, you need to replenish that drug. Right? So if you're on a drug that you take 4 times a day, a simple logic, let's say paracetamol. You take paracetamol 4 times a day, you take 500 milligrams. The half-life of paracetamol is 6 hours because the interval between dosage is determined by the half-life of the drug. So that determines when you are going to take the next one. So if it's 6 hours, that means if you take 500 milligrams 6 o'clock in the morning, 12 o'clock in the afternoon, 12 o'clock in the 6 o'clock in the evening. That's how it's supposed to be. So at the end of the day, you take 2 grams. So what is asking, can you take 1 gram in the morning and take 1 gram in the evening? No. You cannot, because what I have just explained. However, there are some drugs that their half-life is 12 hours. So it's not that one that you are taking 4 times that I will place you on. I will not place you on drug that you can take twice a day, not necessarily increasing the dose, but the interval between administration of that drug is 12 hours. So that's why you can take in the morning and in the evening. But the one that you take 3 or 4 times a day, you cannot increase the dose so that you can take the same amount. You take morning, you take in the evening. It means that at a certain time, there will be a time during the day where you will not have that drug in circulation in your body. And the effect will not be felt. And particularly if it's not antibiotics, it's very bad. Because you will not start talking of issues of resistance. You may take the drug and it may not even work for you. So the next person, please.
Assalamu alaikum. Thanks for our doctors. I want to ask, like combining meal with tea, that you want to drink tea along with the meal. So whether at the breaking of fast in the evening or in the sahur, what impact will this one have? And if there is any advice in that respect.
Please.
That is to combine tea, like say you make beverage milk and you drink it on top of your sahur food or the iftar food.
Did you get that, please? Okay.
Next thing.
Okay. Assalamu alaikum.
Alaikum salam.
I want to ask about the intake of the cold water during the time you are breaking your fast. You know, during that hour, your body, you feel thirsty and want to drink a lot of water, and then you now hear that taking a cold water is having its own side effect. Then you now look at it that, is it possible for me to go and be taking a warm water and during the time of breaking fast? Then another one is then the intake of both the yogurt, milk. So there is a statement that there is a particular age when you are above 50, you should lower the intake of your milk. That is, the consumption of the ink is not good. But during that time of the fasting, you look at it that you use it to control your at least your body stream.
To replenish the lost energy. The use of cold water and probably consumption of milk. Next person, Salau.
Assalamu alaikum wa wabarakatuh. I thank all our doctors for the effort. My question has to do with the issue of menstruation. I understand that there are some drugs now that you can take that could either delay the menstruation or that could make you to miss it. Ordinarily for a Muslim, is that Islamic? Because I understand some girls are using it now, even in international world, that they will take a drug and the blood will not flow so that they can fast deliberately. I don't know how good that would be Islamically.
Any other questions? Yeah, in the absence of any other questions, I think we can hand over the microphone to them.
Thank you, sir, for your question. Combining meals with tea. Tea is a beverage. There's no problem combining your meal with tea. If you are not diabetic, you can combine your meals with tea. It's high energy containing drinks. It's better than your sodas like Coke and Cola. But if you are diabetic, taking tea is not advisable because it shoots your blood sugar very high. Fruits, your normal meal, that is better. But taking tea is not advisable. But if you are not diabetic, you can take your tea. You can take your beverage. There's no problem with that. Cold water and diet. The weather is so hot nowadays. There's no problem you taking cold water. The only time we advise against cold water are for children, young children, because of the weather, and it can trigger some form of reaction. Those that are asthmatic, we tell them to avoid cold water baths, drinking cold water. They can drink normal lukewarm water. But as an adult, there's no problem with taking cold water. As your body can withstand it, you can drink cold water. It's not a problem. Yogurt, milk, and dairy products. If you don't have any condition that you react to dairy product, you react to yogurt. There are some people that have what they call lactose intolerance. When they take all these things, they start purging, their belly starts paining them. If you don't have any problem with that, you are not diabetic, you can take your yogurts, you can take your milk. But if your cholesterol is high, there are some form of milk that they will tell you to avoid. But if you don't have any problem with diabetes, your cholesterol is okay, you can take yogurt, you can take milk, you can take dairy products. It's not a problem.
Okay, so I'll take the last question where he was asking about people who take medications to deliberately prevent their menstruation from coming. I think this just goes back to, I did mention about Surah Tahrim, where Allah was asking the Prophet ﷺ that why would he forbid what he has allowed? It's just that simple. Why are we trying to stop what Allah has permitted to come at the right time it was supposed to come? You know, I know some people take, some people take contraceptive pills. These contraceptive pills contain only progesterone to try and prevent them from having menstruation. I don't think that is correct. I think maybe the imams can shed more light, but I think from just normal logical sense in Islam, why are we trying to prevent the natural flow or the natural phenomenon that Allah has permitted for us? I don't find it correct. However, the imams can expatiate on this. Thank you.
Yeah, thank you very much. As a follow-up to that, ordinarily, there are no drugs you will take to prevent bleeding. But however, women on contraceptives, just as she has mentioned, that will have delayed menstrual flow. So the intention is not because they wanted to have a delayed menstrual flow. That's why there are people who are on contraceptives, right? So there are people that are on contraceptives. So when you are on contraceptives, you could have delay menstrual flow, the delay of onset. So that is the situation. So the other argument, which I know we have addressed here, is the use of contraception in Islam. What is the position of Islam with the use of contraception? And I remember vividly, I addressed the issue and said, based on current jurisprudence, Islamic jurisprudence, it is allowed for women to use contraceptives if the purpose is to increase span between age of children, prevent pregnancy while trying to bring up the newborn baby and increase the gap between space the family. And I don't think that when I gave that lecture I was disputed. So so thank you for any. So in the absence of any other question, Imam